Welcome to the introduction of the SureSet device. Standardized securement and access to the IV tubing setup in clinical care. In this video, we will cover SureSet features and some of the important details that are related to placement and the removal of the device. The IV is placed using aseptic technique. A protective dressing is used to cover the entrance site of the catheter to protect the wound site from infection. With the use of the SureSet device, the protective dressing is placed preferably just distal to an IV push-off plate if present. Careful attention is made to not cover the luer connection between the IV hub and luer lock of the extension set. This allows clinical staff to access the IV hub and tubing extension set to perform cares. The device cover is opened so the user can visualize the push-off plate slot and the tunnel portion of the body. This helps target placement and orientation over the IV catheter hub. The protective backing should be removed by grasping the tab and removing the top layer. Grasping the IV tubing and ensuring the push-off plate is facing up, the device is aligned parallel with the IV catheter. The push-off plate is positioned under the slot, and then with downward pressure, the device is applied onto the IV catheter and protective dressing. If present, the push-off plate should engage and be visualized in the push-off plate slot. Taking into consideration the bending tendency of the IV tubing, the end of the extension set is brought toward the desired lateral channel of SureSet. The grasped portion of the extension set is positioned distal to the chosen channel. The tubing is then pressed into the distal and proximal portions of the channel. There are ledges in the channel to grip the tubing and hold it in the channel. Note: the central portion of the lateral channel has a hump that does not allow the tubing to be pressed into the channel. After the distal and proximal end are pressed into the channels, the opposite hand is used to close the cover. You may hear a click. If the U-loop formed between the luer connection and proximal channel needs to be adjusted, simply apply downward pressure to the cover and gently tug and slide the tubing in the channel to the desired configuration. When you're ready to remove the SureSet device, open the device cover and remove the IV tubing. Ensure that the tube clamp is engaged. Grasp the distal portions of the protective dressing and gently apply traction to release it from the skin. When the protective dressing, the SureSet adhesive backing, and device are elevated off the skin and the catheter entrance site is exposed, place a piece of gauze over the entrance site and remove the IV catheter, protective dressing, and SureSet device in one motion. The tubing can be placed in multiple configurations. Position A. In the first configuration, the IV tubing is positioned in the chosen channel and exits the device under the cover and on the same side as the lateral channel. Position B. If there is an IV extension set with more tubing beyond a short extension set, the clinical staff may desire the routing of the tubing using the apical channel toward the intravenous source or patient's antecubital area. Position C. If there is an IV extension set with more tubing beyond a short extension set, the clinical staff may desire the routing of the tubing to exit toward the patient's hand. Staff would utilize the chosen lateral channel, then across the apical channel back through the opposite lateral channel. Access, organize, secure. Thank you for choosing SureSet Securement.